I'm Dr. Angie DeGraio. I'm an OBGYN at Grand Itasca Clinic and Hospital. Some of the more common complications in pregnancy are high blood pressure prior to pregnancy or developing during pregnancy, or things such as preeclampsia. We're also monitoring a lot of patients who have obesity prior to pregnancy with extra monitoring with their babies. Diabetes in pregnancy is also something that can be common and something we're always screening for as well. We have OBGYNs who work here at the clinic and hospital who have all extensive training within high-risk pregnancies as well as normal pregnancies. And we also are closely affiliated with the University of Minnesota maternal fetal medicine specialists to help us for second opinion or consultations in those settings. So if you have a pregnancy that requires specialized care throughout the pregnancy, whether it be something you had as a medical condition before you were pregnant or something that develops during pregnancy, you can certainly be seen here, and we can be kind of the quarterbacks to help facilitate your care, involve the extra specialists and their consultation and recommendations, and then help to carry those forward so that you don't have to necessarily travel to Duluth or the Twin Cities for all of those appointments. We're able to coordinate and communicate with your other providers to keep you as safe and healthy throughout all of it as we can. If you have high blood pressure or diabetes, whether it's before you're pregnant or during pregnancy, those complications develop. Oftentimes your prenatal care will shift to be a little bit more hands-on in the way that you'll have a few extra ultrasounds monitoring your baby's growth. You'll have what are called non-stress tests, or later in the pregnancy and third trimester, where we listen to your baby's heartbeat throughout a visit each week, and essentially serial ultrasound monitoring is going to be important for us moving forward. In the case of diabetes, we're looking for the baby's growth to see whether or not he or she is growing appropriately within the parameters that we're hoping for at each interval. In the setting of hypertension, similarly, we're looking to make sure the baby has creating enough amniotic fluid, watching their growth as well. High blood pressure and diabetes can both be a little bit stressful on the placenta, so we want to make sure that this baby is getting all of the nutrients that he or she needs to be able to continue to grow and thrive in utero. If you are in the stages of labor and a complication arises where you need something such as an emergency C-section or an assisted vaginal delivery, we are equipped and ready to do so. We have a team who is always aware of someone in labor. Their obstetrician will be right there with them and making those decisions. If it happens to be an unplanned preterm delivery, where someone presents and maybe doesn't have enough time to get to Duluth or the cities where we normally would deliver babies who are under 36 weeks, we will certainly do the delivery and help to coordinate. And if we need to have one of the neonatologist specialists come to Grand Itasca to help potentially even transport a baby if needed to a NICU either in Duluth or the Twin Cities, and we have those relationships set in place and a protocol that we use for that to be efficient with it. A lot of women come and ask about who will be the delivering doctor for their baby, and we try very hard to deliver all of the patients we see throughout the pregnancy. But that being said, we have a great system and rotation, and we all know each other's patients very well. So if it happens to be a time when your provider is unavailable or not on call on that particular evening or weekend, we have phenomenal other group of partners who can help step in for the delivery. If you are blessed enough with 2 babies at once in the setting of twins, we can help to take care of you in this setting. We would coordinate with one of the maternal fetal medicine specialists if needed, whether that be in Duluth or the Twin Cities, and just ensure that we have an appropriate delivery plan for you. Oftentimes twins like to come early, and so we're prepared for that, and whether that's too early to be at our specific facility, we can help make sure you know and feel comfortable with the delivery team at another facility such as the Twin Cities or Duluth if needed. If things are going all as planned, and we are happy to deliver twins here, whether that be C-section or vaginally. Grand Itasca Clinic and Hospital, your health is our specialty.